Welcome to the Skip channel and subscribe the channel. Today we will see the upper limb, limb nodes and the limb drainage of the upper limb. Here you can see the some introduction picture of the upper limb, right? Then we will see the what is limb. When the circulating blood reach the capillaries, the part of the its fluid content pass through them into the surrounding tissue as the tissue fluid, right? Then most of the tissue fluid re-enter the capillaries at their venous end. But some of it, however, return to the circulation through the separate set of the lymph vessels. That is called as a lymph, right? Here you can see blood circulating through the capillaries, right? Most of the fluid is filtration, right? Then the most of the fluid re-enter the venous end, but some of the fluid circulate through the lymph vessels, right? Then we will see the what is lymph nodes in the upper limb. The main lymph nodes of the upper limb are the axillary lymph nodes. These are divided into 5 groups. First one, anterior, posterior, then lateral, central and apical groups. Here you can see is a apical group, right? Apical group. This one is the anterior group, right? Anterior group. This one is the lateral group. This one is the central group. This one is the posterior group. These are the axillary lymph node groups. Then we will see each group's drainage. The anterior group, they receive the lymph from the upper half of the anterior wall of the trunk and from the major part of the breast, right? Then the posterior group, they receive the lymph from the posterior wall of the upper half of the trunk and the axillary tail of the breast. The lateral group receive the lymph from the mainly upper limb. Then the central group, they receive the lymph from the direct vessel from the floor of the axilla. Then the apical group, they receive the lymph from the central group, then from the upper part of the breast. These are the lymph nodes received from the limbs from the upper part of the upper limb, right? Then we will see the what is lymphatics. There are superficial lymphatics. The superficial lymphatics are the much more numerous than the deep lymphatics, right? They collect the lymph from the skin and subcutaneous tissue. Most of them ultimately drain into the axillary nodes, right? Then we will see the deep lymphatics. The deep lymphatics are much less than the superficial lymphatics, right? They drain the structure lying deep to the deep fascia, right? They drain the limb from the deep structure to the deep fascia, right? They run along the main blood vessels of the limb and end in the axillary nodes. So both superficial lymphatics and the deep lymphatics are finally drained into the axillary nodes. Then we will see the what are the clinical importance. First one is the lymphangitis. This is the inflammation of the lymph vessels. Here you can see the lymphangitis, right? Lymph vessels is the inflammation. Then second one is a lymphadenitis, right? This is the inflammation of the lymph nodes. It may be acute or chronic. The nodes enlarge and become palpable and painful. Here you can see this is a normal lymph node, right? this is become enlarged, right? Then we will see lymphedema. Lymphedema is the obstruction of the lymph vessels can result the accumulation of the tissue fluid in the area. These are the clinical importance of the axillary lymph node, right? Here you can see this is normal. This is a lymphedema hand, right? And thanks for watching our channel and subscribe the channel.